Good evening to everyone present here with us today. This is Trion from IGCP, today's moderator. I would like to welcome all the viewers who have joined our platform for better exchange of knowledge that is going to be shared by our keynote speaker, Doctor, for today's session. With much pleasure and honor, let me welcome a very renowned doctor, Dr. Sania Hasnan. Ma'am is MBBS, MD at Hospital Administration, COO at Three Peak Health. With the help of ma'am and her wonderful insight, we will be taking a close look on today's topic, which is the AI enabled clinic tools every doctor should be using. Now, without any further delay, I would like to welcome ma'am at our forum and would like to hand over the session to her. Over to you, ma'am.
Thanks, Shreyon. And good evening, everybody. Thanks for taking time out to join today. We've got a very simple topic, something that I personally use in my day-to-day work. That is tools that every doctor should use. How can we have a very AI-enabled clinic around us? Why does it matter? Why should doctors or anybody use AI? Obviously, answering the simple question. That's because a lot of our time is taken up by admin tasks like documentation, chasing reports. So AI can reduce some of the mundane work, repetitive tasks that does not need a lot of a doctor's intellect while performing. Reduces the administrative load and can also support in some amount of clinical work, but we will come to that later. Let's take a look at some of the pain points. The focus of this presentation will be more around helping doctors reduce the mundane, repetitive tasks more than clinical decision. We'll come to some of the clinical decision tools as well, but let's take a look at the admin, workload. So doctors are often bogged down by a lot of administrative tasks, that take you away from patient care. For example, writing consultation notes, summarizing history. We have to write a lot of reference letters, make PowerPoint presentations, search for guidelines, do some amount of research, write down discharge summaries, follow-ups, and so on. This is just to list a few. How can AI support us in getting rid of or reducing the effort that it takes into one of these tasks? There are a lot of tools available, in the market. A lot of them are free. Some of them are paid for. But the intention of today's discussion is to run you through the various tools and the opportunities available, so that it can help free up a doctor's time and reduce the administrative burden. There are medical prescription tools available for writing medical notes. There are AI letter generators for any kind of referral letters, any kind of doctor notes to be written. There are PPT making tools. If you see at the bottom right, I've used, this is an example of one of the tools that I have used in making this presentation. So my focus was just, getting the right content across, but I didn't have to spend any time making any of these slides today. It was all made by AI. Summarizing, doing any kind of research, instead of having to read multiple, documents and make sense of it on your own. You can pull out links of these documents, or you can pull out a PDF version of these documents and, put it into either ChatGPT or Gemini or any of these tools and ask the tool to summarize it for you, give you the most important, information from these, from the links or from the documents and so on. Integration, bringing in integration checks. There are e-prescription verification tools. There are tools that tell you whether a medicine will interact with another medicine, should it be given together. There are clinical decision support tools. There are tools that automate your workflow, that can help you manage your WhatsApp. We're often bombarded with a lot of WhatsApp messages while in the clinic or in the hospital setup, or a lot of emails come to us, and that needs to be managed. Can some tool help you categorize your emails and tell you what's critical, what needs answering, suggest responses for a lot of emails. And some of these tools I'm sure you're already using, you must have come across, but let's take a look at some examples of tools that would be available. One of the most common tools that a lot of us have started using, and if we haven't, I would definitely advise, to try that out, are the AI assistant, the generative AI, the general AI tools like ChatGPT, Gemini, Cloud, Perplexity, and so on. These would help you do any kind of research, read up any kind of literature, summarize articles, prepare SOPs, create any information sheet, clinical pathways, etc. But like I said, these really support you in reducing your administrative burden of actually writing down these documents. But what's important is that we take whatever AI generates with a pinch of salt. We're careful about the content it generates, and obviously we do our check before we finalize any kind of document or send it to a patient. At the end of the day, the responsibility, both ethical and legal, lies with the doctor. So these tools are available, they're excellent. They generate good results if used correctly, but like I said, it's important that we're careful while using these, and use our judgment before it is given to any patient. So quick check. I use a lot of tools in my day-to-day work, but before it's sent to any patient, or where it actually is going to create an impact, I will do one level of check at my end, because I own the outcome at the end of the day. Another example of tool is Medical Focus. For example, these are some of the medical transcription tools like Heidi. I don't know if you heard of Heidi, or Glass AI, UpToDate AI, Doximity. Just to give you some names, you can search on the internet and find a lot of other software available that help you summarize. Your consultation can be transcribed automatically, without it gets recorded, the transcription note, and based on the various templates you're able to put in, for example, start with history of presenting illness. Next, I have a section on past history, family history, drug history, and so on. Medical examination, blood reports, etc. You can create a template and give it a lot of prompts, and it'll generate that document based on the information that it's picked up when you're talking to the patient. So when you're talking to the patient, that's being transcribed, and all of that information is categorized, just the way clinical history, we categorize history of presenting illness, past history, family history, and so on. Examination, and of course, your treatment, any referrals, when to follow up next, and so on. So all of the formatting, all of that template can be put in, and every time you have a consultation, it will generate an outcome note that you don't have to build. And some of these are, I've looked at the I've tried a lot of these software, and they are definitely very useful. They are very interesting. It reduces a lot of workload on the doctor. 10 simple tools as for presentation, creating PPTs, PDFs, etc. Any kind of documents, and so on. So you've got Gamma, which is one example of a tool that I have used. You don't necessarily have to use this. There's some other tools available in the market. So there are a lot of different. What I did was, I knew what I wanted to speak today. I gave it the details of the various the content was given to the tool by me. But putting it across slides, creating these little boxes, etc., all of that was done by AI, and I didn't have to sit down. If I were to do a presentation myself, it would take me at least half an hour to put these in slides. Transcription tools, like I explained to you, some of these could also be integrated with EMR. A quick, once the tools got your discharge summary ready, or your referral letter, or your clinical notes ready, you do a quick check. Like I said, very important to do a check, validate some of the things that is written there, and then it automatically goes to the patient because it's integrated. It could be integrated, and so on. Saves a lot of time writing something from scratch. The traditional method of where a consultation note is, either a recording is done, the recording is sent to the medical secretary, who then transcribes it and then sends it back to you, and then you create a clinical note. All of that, it can go away. It automatically transcribes, creates a document, you do a quick check, and you send it out without having to build anything from basics. There are a lot of administrative support tools as well available. For example, Notion AI, Airtable AI, Zapier, etc. These help streamline your operational work, manage documentation, enhance communication. They'll help you doctors speak to each other, connect you within a system, and so on. I use Otter AI, another example, and I think a lot of you must have also used this or some other tool for any meeting. So if I'm in a online meeting, or even an online consultation, let's say, once you've taken the consent from the patient, or and most of these have very obvious consent on their own, which asks, okay, do I have your consent to use this? And the other person in the meeting can choose to say yes, they've given their consent, or they can choose to decline. Let's say they've given the consent. You should there's the way these summarize, they'll put down all the important notes. They'll take minutes of the meeting for you, so you don't need somebody to do that. You don't need to take any notes on your own. If there are actionables, at the end of the meeting, everybody has been given some task to do. All of that would get summarized by the name of the person, that Sanya, these are the things that you need to complete in the next 2 days or 4 days, XYZ, these are the things you need to complete, and so on. So that level of clarity, and simple communication is what Otter AI brings in. Similarly, Grammarly and a bunch of other tools. So these are again examples of administrative support tools that one can use. Then email and communication tools. These tools revolutionize how doctors manage their inboxes. For example, in communication, they ensure efficiency and free up your time for patient care. Right? Example of some of the tools are Superhuman AI for email triaging, Google Workspace AI, help you write and summarize, and some WhatsApp plugins are also available. They can have an automated answer, or they'll ready the response for you, and you just hit send instead of having to type things down, and so on. Now, one thing is all the tools that are available in the market, right? And I ran you through some examples across different common administrative tasks that we do. But another important thing is, how do we use them? It's very important to use these in the most efficient manner to get the best out of these. A simple rule when it comes to AI, which is garbage in is garbage out. If the input is not good, then the output would also not be good. This is not just for the tool and the technology, the data that they're using to train on. Of course, that is very important. The kind of data sets they've been trained on, if that's garbage, then obviously the output is garbage. That is one thing. But another important thing is the prompt that we give to these tools. The more accurate and detailed and good quality a prompt is, the better the outcome that AI will generate for you. And that's why understanding how to give a prompt to any of these tools is very important. Now just think about this, okay? This at the end of the day, this is not human, okay? Artificial intelligence, we call it intelligence, but it's not really intelligence, right? The system is able to read what you've written, assimilate data and gives you an output. But unlike a human being, it doesn't have context unless you give it a context. Like, it can't see, it can't picture, it doesn't have experiences from the past, right? It if I'll tell the AI that, okay, there's a ship sailing, they wouldn't know that you can imagine what a ship sailing would look like. The sky would look a certain way, it's on water, the ripples of water would be a certain way, and so on. You probably think of a movie that you've seen where ships are. But AI doesn't have that kind of imagination, right? It'll just look at, okay, ship, I've got lots of pictures of ship sailing, I understand the word sailing, and probably sailing on a mass of water. So the more context you're able to give to the tool, the better it is able to understand something we take for granted. And that's where prompt becomes very important. If you give it a vague prompt, write a letter for me so I can apply leave, something like that. But it doesn't know who the letter is going to, what is the reason you want to apply, what is it that you're trying to convey, and so on. Right? You've not given any context, any information. A good prompt, on the other hand, is where you have a lot of precision. You've explained in details what you want. I'll give you some examples of it in the next slide. So, for example, if you give it a prompt, you want to apply leave, for example, and you want to apply leave for 2 weeks, and you want to apply leave for 2 weeks, and you want to apply leave for 2 weeks, and you want to apply leave for 2 weeks, and you want to apply leave for 2 weeks, and you want to apply leave for 2 weeks, and you want to apply leave for 2 weeks, and you want to apply leave for 2 weeks, and you want to apply leave for 2 weeks, and you want to apply leave for 2 weeks, and you want to apply leave for 2 weeks, and you want to apply leave for 2 weeks, and you want to apply leave for 2 weeks, and you want to apply leave for 2 weeks, and you want to apply leave for 2 weeks, and you want to apply leave for 2 weeks, and you want to apply leave for 2 weeks, and you want to apply leave for 2 weeks, and you want to apply leave for 2 weeks, and you want to apply leave for 2 weeks, and you want to apply leave for 2 weeks, and you want to apply leave for 2 weeks, and you want where, let's say you want AI to help you with some clinical decision, or you want AI to help you generate a clinical note, or write down some SOP and so on. A good example of a prompt is, number one, to give it a context. you know think of yourself as a GP, think of yourself as an endocrinologist, think of yourself as an engineer, or think of me as a 5-year-old and explain something to me. The context here is, I'm a GP. I'm a GP seeing a 45-year-old man. It's important to give the gender. Important to give the context of who you're wanting to talk about. Create constraints that keep responses to 5 bullet points. Otherwise, you've seen sometimes it generates very lengthy and document responses, and you don't want to read through a lot of this. It actually is rubbish. So create a constraint around which you wanted to answer, and then define how the output format is. Like, create a concise referral letter using an SBAR format. If you are so The more elaborate your prompts are, the better your responses, the better, more accurate outcome you can generate from AI. A lot of times you would notice that you keep asking it questions, but it doesn't give you what you want. A lot of this is big. One, of course, AI is also developing. I wouldn't say all of them are excellent, but a lot of it is to do with how much information we have given. And that's why, I'm trying to focus today's discussion more on how to use AI. One is, of course, there's AI available in the market, but how to use it to the maximum. uh, um, Explain what you want out of a tool in a lot of details, and try it out a few times. It's not you Everybody with time will be able to improve their prompts. Like, when I started using AI and giving it prompts a few years ago, to what I explain to AI today is very different. I'm able to give it a lot of context. I'm able to give it a lot of constraints around which I wanted to answer my questions, and I'm able to tell AI exactly what I want out of this. So here's an example. As a senior consultant endocrinologist, summarize the latest ADA 2004 guidelines for type 2 diabetes for junior doctors in 5 bullet points. Include drug sequencing, contraindications, monitoring, and keep it concise. So, and in fact, you can elaborate it further, more than this as well, right? So why this kind of a prompt is better than just saying, give me an output document, because there's more clarity on the role. Who are you creating this for, who's the audience, a clear structure, a clear output, and also you've explained what document to use. Otherwise, it'll pick up anything from the internet. A lot of times when I'm trying to generate an outcome, especially when I'm doing some research or anything clinical, I don't want AI to go over Google and pick up some news articles, etc., and start quoting that. I will give it the link that I want it to give me, a summary or an output from. What would I do? I would probably go read, 2 or 3 guidelines, right? Clinically relevant guidelines. I'd give AI the link to, restrict your research to these two, and then give me an outcome. So you can get anything done, but as long as how to use it to your benefit. Again, transforming clinical workflows with prompting, right? You can use prompts to create patient-friendly explanations. Sometimes if it's difficult to explain, you can, ask GPT to simplify it, write it down in brief, probably no more than 100 words, and explain this illness or this condition like you would explain to a 10-year-old or to somebody who's never heard of something or doesn't come with medical knowledge. It'll help you generate that kind of response. It'll help you summarize long clinical guidelines. So, you pick up any article, any case study literature from the internet, and ask, give me 5 main points that this document is trying to explain. Don't lose the essence of what it's trying to tell me, and highlight anything that's important. Put forward any facts that are mentioned, etc. And give me, don't skip out any data. Give me a list of all the data and explain the methodology in brief, right? So that's an example of how, few things that I would want out of a document, and I would explain some of those. You can write care plans, etc. Like I said, you use SBAR or any other format. You explain the format. A lot of these formats are well understood. SBAR is available. If you search for SBAR on the internet, it's a standard tool. So your AI would also know. But if there is a way which only your hospital or your clinic uses a certain care plan, then you'll have to give that format to the AI tool to be able to generate that outcome. You can generate all kinds of notes. You can turn scan documents. A lot of times you've got something on a piece of paper, and it saves a lot of my time having to type that down. I'll take I take a picture of that and upload that, and I'll ask AI to convert that into written literature, and I've got that quickly available without having to type anything. Rewrite content for different audience. So you've got the same literature. You can write it for your colleague. You can write it for an audience where you have doctors in the audience versus when you have patients in the audience. The language that you will use, the examples you will use will be very different. So you can generate a literature for a different audience as well. So that is about day to day, the more easier tools that we use. This is more clinical decision support and medicine and clinical related. I've discussed this in a lot of detail in one of my earlier discussions, but I'll go through it in brief today. There are a lot of clinical decision support tools available. For example, IBM Watson, Mayo Clinic, and these are just examples I'm giving. Like I said, some of them I've used, some of them I haven't, but there are a lot of other tools available that support doctors in clinical decision. It's literally like they've got a lot of medical literature, they've got a lot of data that they have used, and a doctor in their lifetime would probably see 500 to 1,000 different diseases, but there are millions of diseases in the world. So our knowledge would obviously be restricted, and it's okay to use decision support tools. For example, there are diseases that are endemic to a certain area, and you wouldn't come across a doctor based in the UK or US wouldn't come across tuberculosis as often as a doctor in India, and wouldn't have that amount of experience. Of course, theoretical knowledge, but the amount of experience. But on the other hand, AI can overcome some of these problems. For example, it can have data available across the world. But what becomes important is for us to understand how accurate that data is. If we have tuberculosis data, for example, it should also know, okay, what geographical location was the person based in, what was the demographic details of the person, etc. Because you can't extrapolate one demography's data to another, because there are demographic differences in the way people have diseases and illnesses, and the kind of treatment that affects everybody, and so on. So obviously, going back to the input, we as doctors should always question and try to understand what input data any clinical decision support tool is using. There was a time where AI was a black box and nobody knew why it's deciding what it's deciding, or why is the output. That is another thing that is gradually changing. A lot of AI tools will have explainability. That's the word, explainability. It'll be able to tell you why it gave you the output it gave you. What were the 3 or 4 things it put together to give you the output? The more you understand the thought process, the more confident you are also about the answer, and you will be able to use that. So a lot of clinical decision support tools will not just give you an output that, hey, this is my recommendation, or this is the differential diagnosis. While it does, you will be able to question, did you pick some of these differential diagnosis? Why did you pick this treatment recommendation? And if you're able to understand the why, then you'll have more confidence, because you would have understood. Some imaging AI tools as well, not just for internal medicine or clinical decision support and so on, but also for radiology, for triaging, and so on. So automated, CT, MRI reporting, in triaging urgent findings, pattern recognition, faster turnaround time for your reports, and so on. Some of these tools, a lot of hospitals and clinics are already using them. Also in pathology and dermatology, like Derma AI, Skin Vision, Lunit Insight, and Page AI, and so on. They'll predict any kind of malignancy. They'll classify histopathology. They'll do an image-based triage, and so on. And of course, precision medicine and AI and ML, right? You can have algorithms that decide how a person, what treatment a person should be, and it keeps learning, right, based on new information available to it. So I've worked with some companies that have, they've built their own AI ML algorithms for precision medicine. We can do a polygenic risk scoring, predictive analytics of chronic diseases, population health stratification. Personalized treatment plan is a very common use of, AI ML, and obviously identifying, if somebody is a responder versus non-responder to treatment, and so on. Another area is wearable devices. These are some examples, but there are a lot of wearable devices or even other tools that can, bedside devices that, have been invented that, can predict an outcome of an asthmatic attack or a cardiac event, etc. Right? There are tools, and some of them are built in India, by engineers and scientists in India. A lot of them are actually. So early warning signals, they'll give you health trends. You can, remote monitor your patients, which means obviously the more remote monitoring or real-time monitoring and the more accurate monitoring there is available for patients, the early we could discharge them, the early patients get discharged. It's well known, right? Patients recover better in a familiar and more home environment than in the hospital. So step downs can be quicker, discharges can be quicker, recovery can be better, and with close monitoring from the medical team, it doesn't have to be this all the doctors watching over patient all the time. A lot of this can be automated. Simple symptoms can be addressed automatically, or you can have a nurse addressing it. The system can suggest to a nurse, and the nurse can give a go ahead on some of these simple ongoing symptoms and the care, but and some of the more complex ones can come to doctors, so you can triage a lot of patient care as well. Not everything needs a doctor's attention all the time. Just because we have a lot of monitoring and a lot of data does not mean that we bombard the doctors with n number of notifications and information. Another very important bit about technology is that any notification that comes to a doctor that the doctor does not respond to is basically noise, right? And we need to get rid of such notifications. If you are not responding to something, that means it's not needed and it shouldn't have come to you, and it's just adding to all the clutter and the noise that you have. So a lot of new tools try to triage the notifications or the alerts that they generate for clinical teams, and only where you must, like if it is needed for a doctor to take action, only those come to you. The others, some of them could be automatically taken care of if they're non-clinical, or can probably go to nursing or any other teams, or just customer support as well if it is not clinical, and so on. Voice-based AI for bedside, so you've got smart stethoscopes that are being built, AI, vitals interpretation, voice command, EMR navigation, bedside clinical search using ChatGPT, and so on. Some of these, things that are also available. And of course, future in clinics. So what would any doctor's clinic look like in the future? And this is near future. This is not far away. This is not 20, 30 years from now. This is, just in a few years' time. That's the speed at which things are changing. There'll be automated triage, and that's a very valuable bit of AI. Everything does not need to be in the same queue. The less important things, for example, patients, coming to you with follow-ups. Some patients just need a repeat prescription with nothing. Now, repeat prescriptions, don't need to be in the same queue as new prescriptions. New prescriptions would need, more attention from a doctor than a repeat prescription. Then automated notes, real-time clinical decision support, predictive risk scoring, AI-driven chronic care plans available, personalized nutrition, sleep, and other suggestions, and a fully integrated hospital data flow. A lot of hospitals are already using this, but even your own individual clinics could be using some of these. While AI is available and we can leverage it constantly for our benefit, but what's important is the ethics, the safety, and the governance, and the responsibility lies with each one of us who's using it. Implementing an AI in clinical practice requires careful consideration of ethical guidelines, patient safety, and a robust government framework. We need to consider data privacy, whether you're following the HIPAA guidelines, the GDPR guidelines, or you've got your own guidelines, within a hospital setup. Be aware that there are biases yeah, in AI. Like I said, the kind of data it's being trained on, that it's used to generate output, and as doctors it's very important that we question that. We try to question where and how it generated the response it did. Ask for transparency in algorithm. What were the inputs. That's why you would have seen, if you were using, just give you an again example of the um, generative AI, like your chat GPT and so on. Earlier it would give you an output and there was no visibility on where it was coming from, but now with every output you see there's a small link available and it'll tell you the document it's used to generate that data. So you want that level of transparency. You want to be able to question, okay, where did you get this information from? What were the 2 or 3 things you put together? Remember, the clinical responsibility lies with us. This tool is to support us. It is not to treat patients. It is not to replace doctors or any healthcare provider. That's not what these tools are meant to do. They are only here to support, to reduce our unnecessary work that doesn't add direct value to patient care. So always verify any recommendation, whether it's your own clinical judgment. If you're unsure, you're reading up clinical literature, asking a senior, checking with a colleague or whatever it is. But remember, always verify, be very sure that you are confident of the response that it's given, and then move it forward. AI is only there to support you with, like, putting things together and reducing burden, but it's not replacing any of a doctor's intellect. What should or we start doing, right, as doctors? And that's what today's session was, to how can we leverage AI and how can we start using it. I would suggest start using some form of AI, whether it's transcription, whether it's a meeting note, whether it's automating your WhatsApp messages or categorizing your emails, or just using, Gemini or, Chat GPT or anything of that form to, ask questions, build documents. Try to automate one workflow that constantly takes away your time. Adopt a transcription tool, like I said. Try it out for a while. You might go over a few tools before you find one that you really like. Learn the basics of giving prompt. When I say learn the basics of giving a prompt, it doesn't mean you need to pick up a course or start reading up. Just try. The more you try, the more you use these tools, you will realize the more context I'm able to give, the more I'm able to explain what I need from the AI. That's prompt, right? The better my prompts are, the better the outcome of what I want from the tool. And obviously stay up to date, especially with the clinical AI guidelines. So, key takeaways from today's session. AI will be able to reduce some amount of cognitive and administrative load that is not contributing directly towards patient care. It would be able to enhance the diagnosis, workflow, and safety. It creates guardrails. When I say safety, for example, it will be able to tell you, okay, patient A is allergic to certain drug, and you shouldn't give that. All of this data is there, or it will tell you drug interaction. It could verify prescriptions for you, and so on. And prompts that for your clinic, to support your clinical skills. Then doctors who adopt AI, obviously, early, will be far more efficient. You are able to concentrate on patient care. And remember, like I said, there's no way this is trying to replace any clinical acumen or intellect of a doctor. It is only here to support and make a doctor's work more efficient. Now, it comes down to how well we are able to leverage this. Right. Any questions on this? I'll be happy to take them now.
Thank you, ma'am, for such wonderful presentation. We do have some question if you like to take that up. So, ma'am, the first question is, how can AI-powered clinical decision support tools to improve day-to-day diagnosis accuracy in busy OPD settings?
Right. So this is interesting. So a clinical decision support tool is a very vast terminology. Depends on what clinical part of the clinical decision you are wanting to use. Right? Do you want it to diagnose? Do you want it just to if it's integrated with your reports, then all your reports come in and gives you a summary of, okay, this is the snapshot. The bloods, the hemoglobin is low, the iron is low, and the person probably has this. Or do you want that once you have, or based on the inputs and the history that you've taken, do you want it to give you a differential diagnosis with a most probable diagnosis, or if you wanted to tell you, okay, based on some of these illnesses, these are the next referrals that are needed, or would it want you to just generate a treatment plan as well? So some of these treatment plans can also be, that these are the inputs. If patients got cough with fever for 3 days, from this demography, and the trend is right now that there is viral going on, and some of the other patients in the hospital have to, you understand this, past history suggests this, blah blah blah. Based on that, this is the treatment for the patient, and the prescription gets generated as well. So there are a lot of different things that, so a clinical decision support tool is not just one thing. Like, it's not it there are different pieces of it that different organizations would like to automate, and not all of them, or probably all of them, and you can oversee this. So all the way from history when you're taking, to it being transcribed and giving you a snapshot of the health, or blood reports, other reports, radiology reports, and gives you a snapshot of the report, or takes into account the report and the history and gives you the output, or and gives you a differential diagnosis and referrals and next set of investigations and a prescription, etc. Right? So a lot of these are there to support clinical, or just support you with, hey, or prompt doctors that, okay, this is probably the diagnosis, this is probably the so a lot of these outputs that the clinical decision brings out, they're in a way suggestions. Okay, it's not saying that this is the treatment and you can't change it, right? These are all suggestions that comes in and makes things easier. You look at it, you wouldn't have to create a whole prescription, you wouldn't have to create a whole summary, or you don't have to think of all the differential diagnosis there could be and start investigating all of them. It's already done that for you. It's already suggested all the investigations, and you can pick and choose. I want to fine, I don't think I'm suspecting this, I'll probably skip these out and I'll go ahead with these. And so that's the way clinical decision support would support day-to-day OPD work.
Next question, ma'am. Are there any specialties where AI diagnostic tools have already exceeded traditional accuracy benchmark?
Yes, quite a few of them actually, especially when it comes to radiology, being able to, a lot of these are being used for cancer diagnosis, especially because, malignancies of different kinds, because it's got millions and millions of images of, of various radiology reports, and it's able to compare those. So a lot of, I think, radiology image comparison is it's something that AI has been able to do very well, more than other areas. And I've seen that this is an area that it's definitely excelling it. Wherever there is an image, it's fairly black and white. You can compare a lot of the different ones, rather than the very gray where there's a lot of history being taken. Sometimes it doesn't understand accents, sometimes a lot of history. Like in medicine, there's a lot of, in healthcare there's a lot of data, but a lot of that is not very easily usable. So yeah, but images become very easy, and that's one of the initial AI, right? You saw Google Photos, for example, right? The way Google Photos has improved, and it can guess right? Even if there's a picture of yours as a child, it can guess and say, is this you? And it picks that up, right? So image recognition was one of the initial bits, and a lot of work has gone. The same thing is being used very well in any kind of radiology, especially for cancer screening or any kind of other diagnosis. Yeah.
Ma'am, there's one last question. What are the legal implications for for clinicians if an AI tool contributes to a wrong diagnosis or treatment?
100% yours. Like I said, the entire liability is on the doctor. The tool is there to support you. It is not there to replace you. So it's the same thing as, for example, in clinical practice, I would never take a syringe that is pre-filled by someone else. And they tell me, okay, it's got an omeprazole in it, give it. I would never do that, because at the end of the day, the legal, responsibility is mine. I will always fill up my own syringe, right, from the vial, so I know what I'm putting in. I've looked at the expiry date. I've looked at the drug. I've seen that it's, the seal was not broken, and I'm doing it, and then I fill my syringe and I give it, right? And that's the same thing. But I would, right, if I'm working with a nurse who's supporting me, he or she might, fill up a syringe and give me, and I would use that because I have that trust on the person. But the liability is mine, right? So we do take support, right? Some doctors would, give their passwords. I know the reality is you would give their passwords, etc., to your assistant to, do your work or fill up something, and that's the reality of what we do. But you are being responsible for anything that anybody else is doing to support you. So there's nothing new in this, right? In reality, we are already taking support from people to reduce the burden on ourselves. So if you're taking support from AI in any way or form, the entire legal responsibility lies with the doctor. And that's why the focus and the emphasis on check, you're responsible, validate, ask why it answered, gave you the suggestion it did. AI can make mistakes. It's that we will never hit a point where AI is the new doctor and it is deciding, and there is nobody else responsible and the company responsible. That's never going to happen. Entire responsibility when it comes to healthcare is on every doctor. Remember, it is only here to support you. It is not there to replace you. It will not take up your legal responsibility.
Thank you so much, ma'am, for making this session so interesting, and it is a really unique topic for our listeners. So, ma'am, before concluding, any take home message from your end?
Just one, like I said, the world around is changing. People are using new technology. Try using it in your day to day. It's not very difficult. A lot of people think that, it'll take you away from cognition, and, there'll be brain rot, etc. These are some of the common worries. That's not true. It's not, you'll have newer ways of thinking. You'll have newer, the other things that your brain will do, right? Just because you're asking some AI to write a letter or an email for you does not mean, our brains would rot. I've still spent a lot of time thinking, and a lot, on intellectual capabilities in a day. But it's really cut down on a lot of unnecessary work that I used to do, of thinking what I should write, or research that I used to do. On any clinical literature, or even making presentations, etc. So start using it. The more you use it, the more you'll see the power of how it really improves your day-to-day. Start using it with probably non-clinical things if you're not very confident of the output, and then look at clinical bit. But don't refrain from using it. Just start now.
Thank you so much, ma'am, for this wonderful session, and thank you for joining us today. It's a pleasure to have you here. Thank you.
Thank you so much. Have a lovely evening. Bye.
Same to you, ma'am. Bye.